Hello everyone, welcome to Stay Healthy Dr. Talk with Facebook Live from Bumrungrad International Hospital. I'm your host today, Dr. Suwat, and I'm really excited about today's topic because this is one of the emerging disease, not also in Thailand, but also like over the world, which is the lung damage that was post-COVID infection. Of course, we know that COVID has affected like other organs, like brain, like the heart. But anyway, we all know that the lungs is the most affected organ in COVID-19 infection. And today we have a really special guest. He is a American-born pulmonologist and also a critical care specialist. Of course, he's now taking care of a lot of COVID patients. Please welcome Dr. Chok Limsuwat to our show.
สวัสดีครับ Thank you Dr. Suwat for the very excellent introductions and thank you for Bumrungrad Hospital to having me too. So I think today the topic is about post-COVID, right? But
yeah,
I think this is more likely we talk about story about COVID because I think we know COVID for about almost 2 years.
Yep.
So we can start with like talk about what happened before, right?
Okay. Because we all know that there's a lot of questions. Well, after we have COVID, what's going to happen? So, with your experience, why don't we start with that? Okay. After the patient was discharged, like okay, they don't have any fever, the cough is getting better. What symptoms will they need to face when they go back home?
Thank you for the questions. Basically, I'm gonna go back. Just like the story, because when I taking care of the COVID, it all start from the beginning, right?
Yep.
So past year, when I got the first COVID patients, and I got the first consult, I still remember that feeling. Patient come with pretty bad respiratory distress. They have abnormal X-ray, and question in my mind is we don't know much what's gonna happen afterward after they getting better. Because our goal here, we always treat the patient to go home. But
right.
My question is, when they go home, what's going to happen to them in terms of the recovery? And are they going to be the same as another pneumonia, ARDS, when they're getting better? So last year, we don't have any answer yet. But this year, I think we get some answer already. When the patient recover from the COVID, there is some organ that could be affected. I'm gonna show some slide right here. So first of all, when the patients getting better from COVID, in a month, 4 weeks afterward, they still can have the symptoms. And in the literature review, they call this syndrome is a post-acute COVID syndrome.
Post-acute COVID syndrome.
Yeah,
so that's what we call long COVID syndrome.
Actually, they right now they have a lot of subcategories. But the post-COVID syndrome is just someone after 4 weeks they still have remaining symptoms. They call post-acute COVID syndrome.
Okay.
And then after 4 weeks, about 8 weeks to 12 weeks, which is about 2 to 3 months, if they still continue to have the symptom, they call subacute post-COVID syndrome. And really long COVID syndrome is something persistent after the COVID for 3 months already or 12 weeks. We call that long COVID syndrome. And there's so many names.
I see.
Yeah, so but I think this is very easy to remember name. So we call it long COVID syndrome.
Yeah, it is the name that we can do with like Google search and we see what it is, right?
Exactly, yeah. And then I think at this point, I think all the patients who experience COVID, when they go home, if they still have some symptom, if they have the Google, they probably do the Google and check what will happen to them.
Of course, we all do that. Okay, now please shed some light then. What is it? What is long COVID in the name?
Well, per the definition, I think you know already, is this have to be something persistent after COVID about 3 months. And what could be the effect, okay? For the most common effect after the COVID, after 3 months, the symptom that patient report is fatigue. Some literature said it's up to 70%. Patients come to my clinic. I also experienced that they still said, I'm not the same doctor. I'm still weak. I cannot do things very well. What should I do? That's one of the most common symptoms, okay? And then afterward, some symptoms such as coughing is very, I see it very often too. Up to 30% of the patients have long COVID, they still have some dry cough.
Right.
And some patients still have chest tightness. And then sometimes I send to cardiologists too,
I see.
just to make sure. Yeah, and other than that, another very important thing is they still experience dyspnea, which is feel like they shortness of breath. Some patients still have low oxygen level, even 3 months after COVID
3 months.
treatment finished already.
I see.
You know, so this is very big impact to the medical world, because before COVID, we all know that when patients have lung infections, like bacterial infections or influenza,
Yeah.
after we discharge them, mostly patients getting better within like few weeks afterward, and they go back to work already. Very small amount of population, they still have some lacking symptom like COVID happened. So so at this point, I just go back and search for the from the literature. So what I see is of the patients who have coronavirus infection in the past, like MERS or SARS,
Right.
they all have long symptoms.
So it's like the same thing.
Yeah, it almost the same thing. When they're getting better, they still have all of these symptoms. When we look at the specific organ, I'm gonna categorize it. Okay, so for the mentality, some patients they experience depressions, they cannot sleep well.
Right.
Yeah, and for the lung, you know already that some patients have what we call long pneumonia or long infection in the lung and scar in the lung as well. Apart from that, I have seen many patients already, they treat for the COVID infections, they went home, and 4 months afterward, they come with the legs swollen. I mean, not 4 months, 4 weeks afterward, they have legs swollen.
Why?
That's probably with, they have a DVT, which is the clot in the legs. So this is very interesting thing because most of the pneumonia in the past, nothing like this happened. When they go home, usually they don't get the clot effect, but in COVID, we still have to do something, follow them up, look at the blood work. If they have something like D-dimer, which is the marker is really high, we still need to put them on the anticoagulant though.
So the effect is like when we're talking about coronavirus, maybe it's not just only for COVID-19, but there are like some lasting effect.
Yes.
Like in the brain, like in their hearts, in their lungs, of course, right? And also in like their circulatory system, like the blood clotting system sort of thing, right?
Exactly.
So this is what happened after COVID-19 too.
Right.
Okay.
And I'm gonna make the summary on the next slide. Okay.
Okay.
So we can see this slide is very nice representations. I think I get the information from very high impact factor papers from Nature. So you can see the first week, first couple of weeks when you got a COVID infection, this is the viral phase. So viral in the body and make your body have like inflammations.
Like fever.
Yeah, fever,
body
feeling
aches.
sick, pneumonia, and then you stay in the hospitals. And if someone survived this, you can see the next phase is gonna be the 3-4 weeks, right? So it's gonna have some impact to the patients. So we're gonna go script, and then you see the last table on the 12th week. A lot of patients still have a weakness, have dyspnea, have coughing, and the chest symptom. And on the brain, very interesting. I have a couple of patients who stay in the ICU for long, like 10 days. Despite all the nurse and the doctor support, because when I have a patient in the ICU, they're very sick with the COVID, right? The thing is different from normal thing is they cannot have the family member see them.
Oh, right.
Yeah. And then I think our team, we try to do our best. We try to use the technology. We get the phone, we get the
like FaceTime.
Yeah, FaceTime with the family, with them. If we can, but if someone really sick, we cannot. So we all support the patients. And then I think even though we try to support them in terms of like mentalities, but when they go home, they still feel like they're lacking something, and they feel like this is a trauma in their heart when they go home.
So it's like, well, we are quite familiar with the pneumonia, right? And we have been through like several influenza pneumonia season before.
Right.
But so this is one thing that was different right?
Exactly.
It's like different, like they affect the brain, not just only the lungs.
Yes.
Do you have like how many percentage of the patients that have like these long COVID symptoms, like when their PCR is like negative? Well, from the diagram that you showed before, right? Can I have the diagram back, please? That when the PCR came like negative, it's like they don't have the COVID-19 virus in their body anymore.
Exactly.
How many percentage of the patient that still have like the depression, like the lung symptoms, like the like fatigue, something like that?
Really good question. I think a lot of people in the medical world try to get to this answer, but we don't have the solid number yet.
I see.
What I can tell is the sicker a patient is, the more symptom for along COVID they have.
You have answered the question I didn't ask yet, because I just wonder if is it related with how bad the situation is when they were sick, right?
Yes.
Is this just like the condition in the lungs as well? Like if they have like severe disease, they have been on the ventilator, and those symptoms will persist like for a long time comparing to one that doesn't, right?
Right.
Okay, because this is another thing that is like a point of interest today, that about the lungs, that we know that the COVID affects the lungs, of course.
Yes.
And lots of patients will think after they have cleared from COVID, maybe the PCR came back negative or sort of thing, whether their lungs are going to go back to normal because they feel fatigue, right? But maybe the feelings of fatigueness is not because of their lungs, it's not because of their breathing, just only the muscles fatigue. How are they going to know that they're going to have the effect from the lungs, or do they have to come back to the doctors or anything?
So my answer on this slide, I think we need a team. We need a good teamwork to taking care of the post-COVID patients. So a lot of paradigms or the diagrams in many papers, they suggest already in European country, they start having some protocol, like if the patient have bad COVID in the ICU, they on high flow oxygen cannula, which is very high oxygen to the nose, or they on ventilator, or they've been in hospital very long, or they very old. So they need to come back to see the doctor. Usually they suggest within 4 weeks.
Within the first 4 weeks?
Yes, first 4 weeks after discharge. And some, protocol even make it harder to do it, but I think we can do it here. So some very sick patient, they need just a week and they have to come to see the doctor already.
Yeah, that's true. But what about the patient that doesn't have like the COVID pneumonia at first? Because like we know that lots of patients now, even like 50 or 80% in some research, that they don't have the lung involvement at all, just only mild symptoms, especially for someone who used to have vaccinated, right?
Right.
And then how they're going to know, do they need to screen their lungs like everyone, or just only the ones that we know since they were sick?
For this question, I don't have solid answer because no recommendation yet. But if they are part of my family, because when we send the patient to the home quarantine or something like that, we usually not do X-ray.
Right.
And if you are young, or we are young, or young people, they may have pneumonia.
If we are young, okay? this is not an if. I need to interrupt a little bit, but we are still young.
Yes,
at least at heart,
right.
but the numbers doesn't matter. Okay.
Yeah. So we don't know for sure if they have a small pneumonia or not. So I think I would recommend them to at least have one X-ray afterward for at least like 3 months apart, and if something like clear.
Okay.
X-ray is clear, nothing to do.
So if it's the case, that's possible, right?
Yes.
If it's not, it's like in your slide here, right? If they have the symptoms that they're not quite sure, so they just go to visit the doctor for some evaluation.
Right.
Okay.
And let's talk about someone who come to my clinic after COVID pneumonia, and they're still sick, they still have low oxygen after few months already. What we do here, okay? So we do very comprehensive tests here. We do we get to the lung functions to see how good they are breathe, how good of the gas exchange in their lung, okay? and we do the CAT scan, which is the scan the lung to see any problems stay there, any problem like scarring in the lung or pneumonia or inflammation after the COVID, which it happens quite often.
So that's the way that we see the residual lesion, right?
Right. And apart from that, I think we do tests for the blood work to see anything look like clots still going on in the body, like check for the D dimer, check the kidney functions, and any organ that's really often affect from the COVID infection too, when we taking care of the patient here.
So it's not just going to be only you then, right? If the patient has like the residual symptoms, there might need to be like a infectious specialist, cardiologist, or maybe is there
hematologist and sometimes psychiatry too send to all of them, because whoever see the patient, we have to be like primary care doctor, and we triage the patients if they still need lung doctor, which is myself or not. They need the hematologist doctor, which is the blood doctor, to taking care of the clot, or they need the heart doctor to taking care if they have a chest pain. Because sometimes when COVID patients go home, they still have a little bit higher risk for the heart attack compared with the normal populations. So we always do that too.
Yeah. For you guys at home, that the COVID patient has like increased the incidence of heart attack or the stroke or any blood clots, to be exact, and so it's not like the risk goes down when they go home, right? So there might be because the symptom is because of the blood clot that follow, like you said in your case, 4 weeks later and it happens, something like that.
Yes.
So it's going to be better if we can check. Is it? Okay.
Right.
It's quite convenient though for here that we have all the modalities that you have been mentioning about. Back to the lungs then. So if they have the symptoms of the pneumonia since at first, if whether they are in the hospital or they are on home quarantine, after it was subsided. So how many of the patients that come back and see that there are some residual lung lesion, there must be someone who is just completely gone, right?
Right.
And there must be someone who still have like lung lesions or like the poor oxygen level.
Yes. So before we go to that point, which is I have some particularly number on the back, please. So we can show you a little bit of one of very impressive case that we taking care of the patient here.
Oh, I see.
Yeah.
Okay.
So basically, we can look at the X-ray. I think everyone can tell this is relatively normal X-ray, but on the left lung, you can see a little bit of like haziness. This is from beginning of the patient who have been diagnosed with COVID.
I see.
He stayed at the outside hospital though, and one day, this is almost like a story that I never forget.
Oh dear.
So after he's been in the hospital for a while, he got really bad attack from COVID.
Oh wow.
His lung and his meningeal break both sides, and the air is just like he's swollen. The skin, everything is swollen, and then
how quick does this happen? Since the first chest X-ray, that doesn't seem to be anything much, and this one.
This is progressed very fast on this guy, and then the family like need another opinion, so they try to get to our team here. So we take the patient. When we take the patient here, we cannot say 100% this patient gonna be survive because he's on really high setting of the ventilators.
Yeah.
So afterward, we did a CAT scan. This is the lung on the CAT scan that have a COVID. We can see that his lung is break, and there's a lot of pneumonia going on in the lungs, and part of that is COVID. And another part is maybe bacterial pneumonia already.
For the basis, what actually do we going to see if the CAT scan came back like normal? So the air needs to be like black, right?
Yeah, it's gonna be the black, which is not really shown in this slide at all.
Right,
So this is almost 100% of the lung that abnormal. So after we try really hard, we have a big team taking care of these patients: lung doctor, ICU doctor, infectious doctor, cardiologist, and rehab team. Okay. and we do the surgery for him too to repair the lung. So after a month, we get him off the ventilators.
A month. Okay.
Yeah, a month. And
Wow.
then right now, he's able to walk.
Oh, wow.
Yeah,
That's
and then,
pretty impressive.
And then we closed the tracheostomy already. But what I try to say is about this case is this is very impressive because we see all of the long COVID problem in this patient. He have all insomnia. He have coughing. He's weak. He need rehab. And then I think this is a prototype of very sick patient after COVID. So that's why I bring this case up. So what I try to say is these hospitals, we have the potential to taking care of these sick patients,
Right.
and he getting better and he can walk. So we think we set up very good team here to taking care of this matter. So this is what happened in one particular case. We have more, but I just showed you one case that I think is very impressive.
This is the thing that we don't see pretty often, right? We know that there's a lot of cases and we know that these things happen, but we don't actually see how it looks like in the chest X-ray or the CAT scan. And so this is like the most that happen in the ICU patients, right?
Right.
The patient that really sick and they need to go through all this. So it's like going to be, wow, how can they like recover from this, like
Yes.
come back to like
And
walking?
this is put a lot of effort to the ICU doctor, my colleague. So we have to support not just the patients because he cannot see the family. We have to talk to him when he on the ventilator, tell him what's going on because I'm not so sure like he's on sedation, but he's still aware what happened. And we have to update the family because this is really separate thing.
Yeah,
when we're taking care.
For you all at home, that lots of time that we put the patients on ventilator for a long time, and all those tubes and lines is not going to be a good experience no matter what. And lots of times that we need to sedate the patient, that we need to put them to sleep for like a long sleep for quite some time, maybe a week, 2 weeks, 3 weeks, something like that, right?
Right.
And another point that we know that we don't allow visiting in the room because we are so afraid of the infection transferring to their relatives. Well, it's a bad disease, but I believe that up your sleeves you have something to fight at. And I know it's going to be that way.
Yeah, and then sorry, I try to answer your last question too about how many percentage of the patient gonna have the effect to the lungs.
Right, because we get those questions a lot, right? Are they going to have any long-term effect, even though they don't have like lung infection at first? Or if they or their relatives have the lung infection, have pneumonia at first?
How would I tell?
And yeah, how is it going to go? How do we go on? Are they going to win the lottery with like residual lung disease or anything? Okay, please.
So what I will say in this slide, I try to make a graphic. So this is for very sick patients. I mean, in the ICU or they need high oxygen level. There is some review literatures. They show already that the range that patients still have the abnormal X-ray or have some scarring on the CAT scan after 4 months is about, actually it's very vary.
4 months.
4 months after infections. So some studies said up to 70%, but some studies said like 20%. So the number is very wide range. So what I would say in my experience, almost everyone in ICU and they have very bad CAT scan, at 3 months they still have something in the X-ray.
So there's
but the symptom is vary. Some of them still on oxygen, some of them off oxygen already. So the fibrotic scar, it happened for real. About like 30% estimately from what they when they recover from their ICU.
I need to really ask here because 30% sounds like a really big number.
Yes.
Even the smallest one, the 20%, which is not what we are familiar with the rest of the pneumonia. From those viruses or from the bacteria, like most of them will turn back completely normal. But so this is like up to like 20-30% that have the residual damage, right?
Right.
Okay.
So let me try to explain to the simple way. So when the COVID attack the bodies and the lung, right? On the left side, you see the normal lung on the like yellow color. You can see that after COVID, I put it almost half of the diagram
Like the
back
red
to the
sign.
normal lung within like 4 months. And then some patients have something happen in between again. They have bacterial infections. They can have like fungal infections. And they can have what we call organizing pneumonia, which is really hard to explain because we don't have the word for the normal people. But this is a very easy word to try to is inflammations that happen after COVID. But it's not from the infection, but just the inflammation afterward.
Even the virus is gone.
Yeah, it's
but
gone.
The inflammation is still there.
Still
right?
there.
So this is like the pink part in your schematic drawing, right?
Yes, and then we see this very often too. And but apart from that, one thing that's really scary is a fibrotic lung problems. Almost like lung have a big scar. Imagine when you have the wound, right?
Yeah.
On your hand, if the wound is very big, when you have the wound healing, you're gonna have some scar left there.
Right.
But the body of the patients, someone who not cope very well, they have a lot of scar more than usual. That's a big deal because when the scar in the lung, it causes a problem when the gas cannot exchange very well. The oxygen cannot diffuse or get through the blood vessels. So they come up with like very low oxygen level and they need oxygen support all the time.
The picture in my head at the moment is like a balloon.
Yes.
Like if we assume our lung like a sponge or as a balloon, and it happens to be like a thick part of the balloon, like
it's become stiff. Yeah.
when it goes out in the sun for quite a long time, or like there are some material stuck in there, right? So it's the lung that doesn't work as a lungs anymore.
Right.
So it's like that. Okay. And so what we're going to do to this, so it sounds like half of the patient has ended up with something still in their lungs by the third or the fourth month.
Yes.
Right? And around like 30% is going to have like fibrotic lung, which is the scar is not going to go away, right? It's like when we have scars, so it's not going to go away for the rest of their lives.
So I have some couple of patients just they can see. So this is the patient
this
who
is
have
they did another CAT scan. Is it?
Yeah,
this is not the same patient.
not the same patient.
Okay.
Another patient who have pretty bad COVID infections and the lung problem too. After a month or two, he still have a problem just walking. He can walk like few steps and oxygen dropped to like 90% already. With the oxygen, he's still short wind. And we did another CAT scan, which is actually on the right side. It's very hard to describe, but it's a lot of scar happen on this guy. So at that point, we still don't have a lot of like research. What should we do with this scar? Some people just said, leave it alone and it could be better. Just wait for the body healing the scar. But there's some clinical trial. They try some medications for anti-scarring. And what we do here, we use the medication too to decrease the scar. And most of the patients that we taking care when we give them the medications a month or two, the scar is getting better and the oxygen saturation is getting better too.
So this is the things up your sleeve then.
Yeah, we have something to do,
Yes.
but the clinical trial about the medication is still continue going on, and we still wait for the big clinical trial to see which one is the best medications.
Is this like a new knowledge? Like because, well, if it's like 5 years ago, when we have like the scar in the lung, maybe post-infection or something before the era of COVID, it's going to be like, okay, it's going to be the scar for life, right? Just like what I just said. So now it's not like that anymore.
So what I would say is, I look back in terms of basic knowledge for the scar forming. In the COVID, a lot of basic science research, they come already. So the pathway that develops the scar, they have many pathways. I'm not gonna talk about that for the Facebook Live. But anyway, there is some medication that runs already for the fibrotic scar in the lung.
Yeah.
And the pathway, which is the way that develop the scar, is kind of like similar to the way develop the scar from COVID. So when I look at that to separate issue, right? So this is the first time that when I go back like 6 months ago, I tried to use the anti-fibrotic on the post-COVID.
Yeah.
On my patient who cannot go home, he's live in another country.
Okay.
And then he's DSAT, he cannot fly back home, he's on very high oxygen. So that case is the first one, even before the clinical trial, we use the anti-fibrotic.
Right.
And after a few months, we don't know for sure if it's better because of the wound healing by himself or the medication, but he back to home without oxygen.
He can fly.
Yeah, but he stay in the hospital for a while because he live alone in Bangkok, and then he not feel comfortable at all to go home with oxygen support.
Right.
But we send him home without the oxygen.
Wow.
So it take like few months. Yeah, but he have to stay here. Yeah, but that's really impressive case too. He said one day he will come back to me and say hello to my clinic.
Right.
Yeah, and then this is another case, same problem.
Right?
Yeah.
Okay. Oh, this is case number 2.
Yeah, but this is the same problem because I show even this case they have less lesion in the lung, but he stay in the ICU.
Right.
But at the end, he's DSAT as well after COVID, and he developed a scar too. So
the oxygen return to be like 93% or something like that.
Yeah, but in room air, so it means that he doesn't have much reserve to do any exercise.
Oh, right.
When he walk, like because in my clinic sometimes I do walk my patient in front of my clinic like 100 meters, and then see what the number come. So this guy turned out to be dropped to 86. Just 100 meters. So this is very important because when they drop very quick, they may have dizziness and they can fall. So I always tell patients that, okay, when you go home, you know your limit, right? Don't walk longer than this, and then check your oxygen when you walk too. And then
I see. Okay, but this is like one of the way out, right? It's like you test the patient at the clinic.
Right.
Okay. Like for you at home, 93% in the room air, that in the air we breathe. Actually, we're not going to feel the saturation. We're not going to feel that the oxygen is low. It doesn't have to be like 95, 96, 97 like what we all have. Okay. But this is one of the interesting points that if you go up, do some exercise and go for a walk, and the oxygen goes down, right?
Right.
So this can be another thing that they can check at home, right? Because we now lots of us will have like the oxygen saturation machine. It's just only a small one, and we can check if we go up and walk to see if the oxygen goes down or not. Can this happen with someone who's sitting talking like us, maybe 97, 98%, but when they get up, they go down to like 88, 90?
I think this is usually if they run higher than 95, it means that they have good reserve. But if someone really borderline already, like 91, 92, 93, when they walk just a little bit, the short wind, they're not even able to climb up the stair.
So they could feel like shortness of breath really, really fast.
Really fast.
Yes.
And really limit activities.
I see. But there are question from Kun Kamalur a while ago that he said that after COVID that the patient has like low oxygen level, weakness, and sometimes has like trouble breathing, right? And the patient is really disappointed and feel uneasy that how many days is going to take for full recovery. I think you have answered this question for a little bit now, since we don't have like the actual symptoms or the chest X-ray or the history of the patient, but so it means that the answer for this question is not going to be in the days unit, right? Maybe it would take weeks, or maybe it would take months for like a full recovery.
Depends, because this question is very good one. But we have to do what we have to do is if I see the patient or someone consult me right now, is very often my friend call for their family still feeling tired after COVID for a few weeks.
Right.
So what usually I make the recommendation is number one, we have to make sure they don't have a complication from COVID, like what we talked before, like organizing, the inflammation in the lung, or the scarring, or the clot in the lung too. So we have to find out anything else before we can say this is long COVID. Okay. Right. So we have to make sure this is not another conditions So that's the first thing to do. And then
Right.
afterward, we treat for the long COVID. But patient need to come to see the doctor for the analysis and do the test and then see what is the best option for the treatment.
I see. So I think that answers the question. Okay, if the symptom is still there, well, we need to go back first, like the investigation. How does it happen? What's the cause? And then we can tackle it with the cause. Okay.
Right.
Another question from Kun Laura. That is there any significant difference between the post-COVID-19 lung damage between adults and children? Like we all know that COVID affects both adults and children, and well, sometimes children can get better like faster than adults. Is there any difference from like quick recovery than adults or anything?
So from what we know is the pediatric populations, usually they have less symptom and less severe of the pneumonia.
Okay, for the begin with.
Yeah, for the begin with. And the reason that adults have more problem is very deep because it's in the basic side, it the immune response.
Immune.
Yeah, for the adult, we have more problem because even I will make the example for the elderly case. So the elderly case, when they have first COVID attack to the body,
Right.
the cell in the body react very slow. The primary cell that attack the infections. But when it activates already, the T cells, which is the memory cells in our body, in elderly people, they react very long and very strong.
I see.
So that's why we have a lot of immune problem after COVID. So think about this way, in elderly, they have this pathway, so that's why at the end, they're really sick from the immune problem. But the kid, they don't have much on the T cells.
Right.
But the innate cells or the white cell that react to the infection, they do really fast.
Right.
So the kid, usually they have like respond very well in the first, and then at the end, they not have too strong immunity response to the COVID. So they don't have inflammation afterwards. So that's why they're not very sick after that.
So it's going to be, so we can see that the long COVID cases or the rest of the inflammation persists longer in adults, right? Especially in
because the adult is sicker. So I think it's more in adult, but I'm not the best person, to be honest, to answer for pediatrics because usually I'm taking care of someone who older than 18 years old here.
Right.
So, but I think it could be applied to the pediatrics, but most likely it's going to be less long COVID in the pediatric population.
I see. No, it's because of the COVID vaccine, right? If there is any question related to this, or if you want to ask about, well, we have lung doctor here, so if there's any question, you can send in the question right now, okay? I have seen that someone is asking about the vaccine, and like for asthma patient, because we have lung doctor, so you also treat asthma patient too. For asthma patient, is there any risk of receiving COVID vaccine?
What I always tell my patient in my clinic, because not just asthma. Number one, if you have chronic lung problem or long-term lung problem, at this time of the year when the epidemic or pandemic is still going on, you need to be well control your disease first. You know, if you use the medication, you're stable, you stay there. Don't decrease the medication by yourself. Listen to your doctor. And when you have lung problem already, it means that you have a little bit higher risk to have complication from COVID.
Yeah, that's true.
Yeah, so COVID vaccination is not optional, it's recommended for all patients who have lung issue, okay?
So what you recommend is they control the asthma, right?
Yes.
Just control the disease before you get the vaccine.
Right.
And actually, anyone with asthma should receive the vaccine.
Right.
Right. Okay. Also, another question from, where are you? Okay. There's another thing from Arif, the same one with asthma, that question, that if the ARDS, acute respiratory distress syndrome caused by post-COVID-19, you mean like after the symptoms subside and ARDS happens again, something like that, I think.
I think from the beginning, COVID have many appearance in the CAT scan or the X-ray. We can do subcategory, but one of that COVID can cause of ARDS too. But I'm not sure if she's talking about if the patients who have COVID, they're getting better and they have another infections and develop another ARDS that could happen as well.
Mm-hmm. Okay. So it's more like when they were having like active infection,
COVID, yes.
something like that. Okay. Another question from Alexandra. Sorry if I pronounce your name wrong. Okay. From Alexandra. I've got COVID 2 weeks ago with mild symptoms and now fully recovered. Congratulations to you.
Yes,
you're fully
congratulations.
recovered. But sometimes Alexandra said that he feel like having fever after activities, not real fever, just that feel hot around his head and feel tired. Why and how long it's going to happen to him?
So at this point, I think this is more like post-COVID. It could be post-COVID symptom, but you have to make sure you don't have real fever, because post-COVID sometimes people have very weak lungs. They tend to have easy to get like another lung infections. I have seen young population, they have like they're 30 years, they have COVID pneumonia. He went home and then he come back in 4 weeks with fever, but he have bacterial pneumonia. So we have, at first, what I would say is make sure you don't have any other infections. And then if it's post-COVID syndrome, you have to do like, I would recommend to do gradually increase your exercise activities.
Right.
And then if the symptom is not subside, you might need to come to see the doctor just to make sure nothing else affect, because you can see already a lot of patients post-COVID, they have another organ effect too.
Right. Okay. So this one is really interesting, but I hope nothing's happen and hope you get better soon. Okay. If you have measured your body temperature, you can send another like answer into this live session for you, Alexandra. And Alim Shariat has asked what to do after recovering from COVID-19. This is a really big question, what to do after recovering.
So I always tell my patient if they're doing really well after COVID infections, they fully recover. What I will say, you are immune and you need to live your life, okay? And nothing to be like shame to have COVID, because
right.
When I see my COVID patient, I feel very comfortable because I know that they got infection already and they recover already. They're not gonna spread the germ to me, because I feel very easy in my clinic and don't feel bad about it. You survive, you're doing well. Just live your life, okay? Think about good thing, optimistic, and then set a goal for the future. Get some motivations. In my clinic, sometimes I talk to the patient not just about COVID, and I talk about what is your future goal, and then try to motivate them to go there too, because this is the way we treat the people. It's not just like medications, but we have to taking care of their mentality too.
Yes.
So yeah.
Yes, also from Alim, that once infected, is there any possibility of recurrence? So it's quite related to the previous question, that what we're going to do after we have recovered.
So when you have COVID infections or pneumonia already, it doesn't say that you cannot have another infections. Think about influenza or flu. When you were a kid, when you're getting older, you have it again, right? Same thing apply to COVID. When you have COVID, your immune gonna come up after you survive or you're getting better for COVID. But after few months, usually 3 to 6 months, your immune start drop down. And then you can get a COVID infection again. And we have a case report already that patient have a COVID second time. And in Thailand, I think we have case already that second time of COVID infection. So you still have to protect yourself, even though you have COVID infection once already.
Okay, that's quite clear. Okay, it can happen again, and sometimes we're not going to push our luck. Okay, maybe one last question here, since like we have been using quite some time. From Miss Van BKK, that my daughter is 9 years old 9 years old.
Wow.
And what should be her vaccination status? Is it immediately needed? She didn't say that. Is there any underlying
So
diseases or not?
for the pediatric populations, 9 years old, from what I know here, I don't think we have any vaccination that have like approved for 9 years old yet.
Not yet, right?
Yeah.
Okay. But keep on track because the information has changed like every day, every other day. Maybe what we're talking today and next week is not going to be the same anymore. So just to make sure that you keep her like from protection, wear a mask, don't forget to wash your hands, okay? I think it's quite about time for today. If there is any like additional question, you can just post below this live session, or you can send in the emails to Bumrungrad International Hospital, and there's going to be someone who help to get the answer for you. And it's also possible to make a telemedicine consultation with our doctors. We could send in the emails, or we can call to the contact number that's going to be on the screen soon, okay? Maybe someone would like to make a telemedicine consultation with you afterwards, okay? And don't forget another thing, that the information changes all the time, and we use our Line official account and also the Bumrungrad application in the ways that we will provide the information that was updated, not just only about the COVID, about the physical examination, about the technologies like the CAT scan of the lungs that Dr. Chok has mentioned. And another thing is about the vaccine. That's one of the hottest topics now.
I think things change every day, just like you said. But so I think we still have a lot of area in the COVID, post-COVID, that we don't know yet.
Yeah.
And maybe next year we have better answer maybe change from today, but at this point this is based on the knowledge.
So it means that we're going to sit here today for the next year, right? For an update session. I will take this as a promise then.
If something big change, we can do it again.
Okay. I think I have. Well, you guys, I hope that you have learned a lot from today's discussion. I know I did. And thank you so much for Dr. Chok, okay? And okay, please stay safe and don't forget to contact to Bumrungrad International Hospital if you need anything, okay? Now, see you.
See
Bye-bye.
ขอบคุณครับ